as the official interviewer for today. Welcome to my show.
Glad to be here.
Welcome to my show.
Glad to be here.
Thank you for joining me.
As always.
Okay, before we kick off, let me quickly mention that the WhatsApp line is open for your questions and messages. The number is 09158494949. That is 09158494949. Okay, all right, are we good? Today I'm talking about my experience with intestinal obstruction, my symptoms, how I was diagnosed and treated, and how I have been living since 2016 as someone with gastrointestinal disorder. The year was 2016. I was already a certified weight management specialist, of course, and it was a beautiful Saturday. I had killed my workout that day. People who know me know that I love my workout, so I love a good workout. I had killed it, and then on my drive home, I felt this pinch in my stomach, which was kind of weird. I didn't ignore it, but I took note of it. So fast forward 2 hours later from that time, I'm going to skip a lot of details here. So fast forward 2 hours from that time, I was rolling on my bed, like in pain, excruciating pain. And I couldn't put anything down. I was talking to a doctor friend of mine on the phone, and I kind of mentioned to him that, okay, look at what I'm experiencing, or, and for some funny reason, I mentioned to him, which till this day, like he's still surprised, that how is it that I was able to pinpoint that fact. I mentioned to him that I had not been able to pass gas and I had not been able to burp at that time. And he was like, immediately, just go to the hospital. I'm going to come and meet you there. There's no need for me to mention the hospital, but go to the hospital. I'll come and meet you there. And hours later, maybe around 4 in the evening, I had gotten to the hospital. Of course, very weak. I had thrown up to five times between the space of 12 noon and 3. I was really weak. I was pale. And, doctors were just asking me so many questions, and I couldn't pay attention because honestly, it wasn't me at that time. So, by 12 midnight that night, which was a few hours again, I had thrown up 13 times. And that time, if anybody that had seen me in the afternoon thought that I was weak, the night was worse. I was so pale, I was white, I couldn't raise any finger, nothing. I couldn't do anything. I was really, really, really weak. I think I had thrown up 13 times by midnight that day. So after all the tests and everything, it was noticed or discovered that my intestines were enlarged, swollen. So the doctors decided to put me on observation for a few days. So I was in the hospital, of course, still in pain, couldn't do anything, couldn't burp, couldn't nothing. No food, just IV fluids was passing through all of my body. So by the 3rd day, the pain was really, really unbearable. And by that time, my stomach had ballooned to triple its size. 9 months pregnancy. It was worse than that. And then it was tender. If you had touched it, you would just be seeing some kind of indentation in my tummy. It was so tender and soft. So the doctors decided to operate. They had been, avoiding taking or making that decision because I had 3 abdominal surgeries before that time, major surgeries prior to that. But at that point, they had no choice. They really had to do or perform the surgery. So they decided on exploratory laparotomy. This is where it becomes interesting. Exploratory laparotomy, XLAP, that's what they call it, short form, is a surgical procedure that involves making a significant incision, very significant, from my navel down, like they practically opened my tummy up. So it involves the incision, that the abdomen, to access and examine. Hence the name exploratory. They have to open and they just look for anything faulty inside in the organs. So it's used normally to diagnose and treat a variety of conditions. This particular part, I'm reading it from Google, such as unexplained abdominal pain, trauma, or cancer. But in my own case, it was, unexplained abdominal pain. Now, unlike minimally invasive techniques like laparoscopy, it is an open surgery. Like I said before, it was open. That can involve fixing a problem or taking tissue samples during the procedure itself. It was major. It was a major surgery. And mine took about 3 hours, thereabout. Now, after the surgery, the doctors, they were telling me that, God loves me. And I know that God loves me because I don't take that for granted anyway. So the findings was that my small intestine was blocked, meaning nothing could pass, not even gas. And it swelled to the point that it affected the large intestine so bad that the large intestine couldn't take the pressure. That one then perforated on the table during the surgery. So they had to chop off the part of the small intestine that was blocked and then the part of the large intestine that was perforated. So that's the story. So I don't have normal size intestine like your regular.
Listening to you just tell the story now, there's a way you're sharing it like, okay, well, it's nothing, right? It's nothing. I know.
It was hellish.
Absolutely.
It was
absolutely.
Hellish.
And I think for everyone, especially, and I was thinking, it's as though everyone who decides to maybe hit the gym or begin a fitness journey, a fitness routine, or become a fitness, professional,
yes,
there are certain reasons behind that. And would you say that this was the reason behind you going into the fitness world?
No, actually,
I was already that, you're already there.
Yes, I was already in the fitness world. I was already a certified trainer. I was already a weight management specialist. So that the reason, my reason for going into fitness, we're talking about that one next week.
Next week.
Yes.
Okay.
I'm sharing my story.
Okay, then I think we can't definitely wait to hear that because everybody wants to know the reason behind it.
The reason behind, yes.
So, but now that you've been able to, at least Nigerians, your listener know your story, they know where you're coming from. But for those who might be looking at how to perhaps, at the end of the day, there's something to learn from every story, something to apply. So what was the reason behind the obstruction?
The reason behind the obstruction. Okay. So like I said earlier, I had 3 surgeries prior to that, 3 abdominal surgeries.
Yeah.
So the reason behind the obstruction is adhesions. I don't know if anybody knows. Adhesions are like scar tissue that form and cause some kind of binding onto organs. So scar tissue had formed and caused my organs to glue themselves together. So especially the intestine. So they now caused blockage in one particular intestine, and that one now affected the large intestine. So and it's not only adhesions that can actually cause blockage sometimes. But in my own case, it was adhesions, and that was because I had surgeries before, abdominal surgeries, major, not they were needed. I'm not saying they were selective.
But wait, before I even go on, how do you feel recounting this experience?
Ooh,
how do you feel now?
it's not been easy actually.
Yeah.
Because I've had to narrate the story over, to people, to friends, and I'm kind of getting used to narrating the story without getting emotional.
Yeah, because you're a survivor, right? Because it could have been worse, yeah?
No, it could have been another story. Really, it could have been another story, because when a doctor comes out and tells you, Madam, God loves you so much, you just accept that really God loves you. So yeah, I always tell the story now from a standpoint of trying to let people know that fitness is not always or shouldn't actually be about physical all the time. You have to take care of your inside. I keep saying take care of your inside. I don't know if anybody that has been listening to me knows me, that I always talk about take care of your
taking care of your inside.
It's important.
I think that's another conversation we should have on fun fitness, because most times when we talk fitness, everybody knows
everybody
the gym,
keeps,
push-ups.
They keep talking about their six-packs and the rest of it. There's more to this thing, So, people don't know there's more to this.
So there's something that's been, fit from within.
Yes,
you can
within.
be unfit from within and be fit outside.
Oh yeah. Oh, totally. You can be looking like a size 8, six-pack and all of that, and you will have high cholesterol. I've said it before now. I have a sister, she's going to kill me. I have a sister that when she was a UK size 8, like really less than, very skinny, she had high cholesterol issues. So you really, in fitness, you don't judge a book by the cover. You can't. You shouldn't in fitness.
Okay, because of our time, when I don't know how, it's almost 7:15 here. Our time is really fast spent. But how was your healing journey like? The treatment phase, how long did it take? And how I don't know, I think it must have been somewhat excruciating, because I don't know, I have to be frank, I haven't experienced this, but with everything you've recounted here, it tells like it must have been a lot. So how was that healing phase like?
The healing phase wasn't easy. It wasn't easy. Even though my doctor said that the incisions, they healed fast and all of that, but I had to be in the hospital for like about 3 weeks without food. Without food, just IV fluids constantly, without food. So because they had to make sure that, again, the insides were fine, and one way for them to know is if the intestines are doing what they're supposed to do naturally. So they had to make sure that I'm burping fine, I'm passing gas fine, and I'm pooping fine, and all of that. Those things have to function before they let me out of the hospital. So I kind of healed fine, thankfully, but I spent like about 3 weeks in the hospital.
And do you think in any way, how has it influenced your journey, especially as a fitness professional?
So prior to that, I won't lie to you, I was all about, I have to be slim, my stomach has to be flat, my this has to be that.
I've seen your pictures, by the way.
My this has to be that. But ever since then, no. I'm more particular about, going to the hospital for my checkups, and my doctors telling me that, okay, this is 100%, this is 100%, this is 100%. I'm more particular about that than the physical aspect of fitness. I'm not saying, we should overlook the physical aspect of fitness. No. But what I'm trying to say is that life comes first of all, before any physical appearance issues, really and truly.
So, I want to put you on a spot. Which do you think is more important? Like when you're talking about one's fitness routine, is it more important to be fit from within than to be fit from outside, or fit from outside and to be fit from within?
For me, definitely, it's more important to be fit from within
than to be fit from outside.
Yes, if we were to choose. If we were to choose. Yeah, I'm not saying
ignore your outside.
Yes, exactly. No, but if we were to choose, it's more important, because you can actually just be standing on the road, waiting for a taxi or a bus or something, and you really do not know what's going on in your body.
That's true.
You really will not know what is going on. Like, again, one of the things that we're going to talk about next week is the heart health. Many people don't even know what's going on with their BPs and all of that, and they're on the road. Like every time I'm driving and I'm seeing drivers, raining abuses and curses, they're mad, those kind of things. I'm like, people stress all the time, without even knowing the consequences of what they're doing. So yeah, it is important to me as a person, as a wellness coach and as a fitness trainer, to pay more attention to your insides than your outward appearance.
Okay, and I think it's important that you'd want to share with our listener this morning how to keep fit and maintain their insides. Maybe you want to share from your own experiences, your own routine. You've been focusing on next week. Tomorrow is still there. You haven't said what we're going to talk about tomorrow. And because
today I'm just sharing my story.
Yeah.
And then tomorrow we're going to talk about gut health because of the intestinal obstruction story that I'm giving today.
Yeah.
So definitely tomorrow I'm going to share with people, how to take care of your guts, your insides, like for real, your innards, how to take care of it and make sure they're clean and all of that. There's no amount of, there's no physical exercise that pays attention to your insides. That's which true. Is one of the reasons why in fitness we say flat stomach is made from the kitchen. It's 80% the kitchen and then 20% exercise. So yes, I'm going to share tomorrow what
they have to do to maintain fitness.
Yeah, but really and truly, it's very important for the insides to be better than.
Just like you've mentioned, just corroborating your thoughts. I think there was a particular billionaire Indian. I think his story was quite common or was quite viral at the time. You're a fitness enthusiast, and he was also like a fitness person. Then we heard maybe was it as a result of lack of rest, or he just suddenly died and nobody knew. One would think, oh, look at you, you're healthy, you're physically, we can see.
It happens a lot.
And whereas we do not know how the inside, that's why you cannot ignore the place of your fitness from within, even as you focus on your without, right? So, but before we conclude on the conversation this morning, I want to know, so far, so good has it been? Since how long now? 2016, if I'm not mistaken.
Yeah, it's not.
It's almost 10 years, almost a decade.
It's not been easy. No, I don't. I still experience some episodes sometimes.
Exactly, right?
There's sometimes. So because of the nature of the intestines now, I have to be very careful what I ingest, what I eat. And even since 2016, it's been a learning experience for me, because it's like every day I'm learning new things, and my body gets used to something today, and tomorrow it doesn't want that thing anymore. So I have to unlearn and relearn almost every day. So I have to avoid, because I can't digest foods the way I used to, so things like I have to avoid acidic food, first of all. Anything acidic, like, citrusy, lemon, and the rest of them. Naturally, I'm lactose intolerant.
Yeah.
So I can't even do dairy anymore, because I get easily constipated, and that's something, I can't handle consistently. And then another thing is protein. I can't overeat protein. Yeah, especially beans, because I'm just going to end up with stomach ache.
One would even one would wonder, with all of these conditions that you have to face every now and then, doesn't it affect, one way or the other, hamper your being a fitness coach?
Oh, it does. It does. It affects, because the spectrum of things that I can eat, or that my body can handle, is quite small. There's only so much I can handle, so I just have to play around, and being a nutritional advisor, I have to still advise people that this is good for you, this is good for you.
Exactly, right?
Most of the things that I advise people to eat or not to eat, maybe large or little of, I can't handle all those things. So yeah, it's I have to just balance the whole thing. It's been topsy-turvy for me. It has been. But somehow I've been able to manage it, even with family, because most times I have to cook my own food separately. Yes, most times I have to cook my own food separately.
That's some intentional living there.
Yeah, it's been it's not easy at all. It's not easy being me. And I'm so thankful for life, because even after the surgery, speaking to people, anybody that hears it say they've not heard of anybody that survives that surgery. Even the doctors told me they didn't want to tell me from the part of like maybe you should be scared or anything. No. So I mean, since then I've had episodes, but I've had like 3 episodes that I will have to go back to the hospital, for some treatment. But the most one was last July. I was in hospital for like about 12 days. I actually feared that I would have another surgery, but I didn't, thankfully. It was a major case of constipation. So they were just using fluids to treat it. So I just stayed in the hospital for like 10-12 days and I came out of it. So yeah, it's not been easy.
Honestly,
I have to be very, very careful.
At this moment, we could go on and on, listening to this and trying to get lessons, and of course, ensure that one way or the other we can learn something from this. But for our time, I'd want you to, conclude this morning.
Yeah, no problem. I just want to use this. My reason for talking about this is to let people know that they shouldn't put off any discomfort for later. If ever you notice anything funny, any discomfort in your body, speak up, speak to a doctor. Go, run, in fact, to your doctor. Don't just sit down and because my intention with sharing a couple of my health, apart from this one, I'm still going to share more, is to sort of demonstrate how, firstly, it is important for us to know, how to report this discomfort to people. I mean, after all said and done, I was told that the intestinal obstruction presents over time in some people, but mine, it just came like immediately, which was kind of weird. It went from 0 to 100 in less than 5 hours. So now that I've shared my intestinal obstruction surgery, I will be talking about gut health tomorrow. What is gut health? Signs of a poor gut, and how gut health affects your weight and ultimately your fitness lifestyle, and simple habits for a healthier gut. But that is for tomorrow. Now, on that note, I hope that with this little story of mine that we are going to kind of have a mindset shift where ignoring symptoms. So on that note, we have come to the end of today's show. Thank you everybody for tuning in and indulging me, and thank you Anthony. Remember, if you think I can be of help with any of your fitness or wellness concerns, you can reach me on Instagram at FitAuntyRuby. And until tomorrow, when I come your way again at 6:30 a.m. on your number 1 Fun Health radio station, 94.9 FM, do have a beautiful day. Bye-bye.